So, and to finish is the Alzheimer study. We, after the pre-geriatric, we had a study pre-Alzheimer with 75 Alzheimer patients. And this you have in your book. I will not too much enter, but we have considerable reduction of geriatric symptoms in the Strath group compared to placebo. And what is, we had a considerable improvement in the Strath group compared to placebo. And what I always wish to use, to finish, to come back to homeostasis, to come back to the health of people, is the concomitant diseases. For me as a German-speaking person, it's an awful word, concomitant diseases. But these 75 patients, they were in doctor's test, doctor's practice, and besides the Alzheimer questions, they also checked normal elderly problems like cholesterol levels, like diabetes, like spinal problems and osteoporosis. And you see now in blue the Strath treatment, in black the placebo. Duration of 3 months, 12 weeks, with 3 points, the first, the second and the third of analysis. And you see the placebo went in parallel down, a reduction of these diseases for the first 6 weeks, and then the placebo group went back to the original level. While in the Strath group, these concomitant diseases reduced further. And what we here looked at were osteoporosis, cerebrovascular insufficiency, hypercholesterolemia, and diabetes. So this was done besides the Alzheimer. These were Alzheimer patients checked on this. And when we say that the Strath has the tendency for the homeostasis, for the normalization of the full body's functions, this is really shown here. Because they were not tested on these parameters. These parameters were analyzed and looked at. And we have improved them. And this is what I wish to have brought to you with my presentation, that you can give Strath to everyone and you will always have a benefit on the body. It will always strengthen and help. And in this context, at the end, I thank you for your attention and I let this here stay. Okay.